If you think about it, 40 years ago from now, was the late 1960s, early 1970s. That was an area of an era of very vibrant civil rights movement. It was also the inception of the war on poverty and the efforts around the Office of Economic Opportunity to develop communities that were at risk. What was formulated then was these movements around health issues, around youth issues, around community empowerment issues. So it was a very vibrant time. There were many community activists. Some were militant. We have some that still reside today, like Richard Moore. I can recall going to community meetings then that were jam-packed at the old Armijo school, which is now charter school. And the place would be standing room only. And there's people that were enthused. Some of them were enraged because of the neglect and poverty that had happened in mostly communities of color. And this was nationwide. But the manifestation in Albuquerque was around the barrios, the older barrios. In this case, Armijo and San Jose and all these areas where First Choice still resides, has a prominent presence. These became alive with these folks that were felt that there was needs that needed to be addressed, that had been left untended, that there was a lot of racial elements to it, and in fact it was born to be true. And so out of that came some very deep thought. The communities were very engaged in conversations around what the needs were. Obviously, health was a big issue.
We canvassed the neighborhood and we asked the residents in the neighborhood, if we formed a new organization, what kind of issues do you think that we should be working on? And so out of that, to no surprise, canvassing, attending meetings, and all of this, healthcare was one of the things that came up continually. People would talk about the lack of healthcare facilities in the valley, not only in the South Valley, but in the North Valley, in the valley area across the board. In doing that, and then kind of assessing the comments that the residents were making, we decided that we were going to open up a health facility.
In that era, in that time, you know, all of this movement was centered around people getting empowered and having access to services, very basic services.
It was a different political era, and you know, everybody thinks about Lyndon Johnson now as being the guy who got all caught up in Vietnam and, you know, didn't run for a second term because of all the anti-war stuff. But he truly was committed to trying to alleviate poverty in the country. And his Great Society program poured a lot of money into things like the Model Cities program and into our clinics and similar clinics around the country.
We put a call out, we had a press conference. We announced that we were opening up a clinic, and we put a call out for volunteer doctors, volunteer nurses, volunteer lab techs, the whole thing. Even to our own amazement, although we did a lot of groundwork on this, but we had over 30-some doctors that volunteered their time at the clinic. And we ran that facility for a while. Only until later on, when the University of New Mexico opened up, in this case, when the University of New Mexico opened up a health clinic, then we began talking about closing our clinic down. From our opinion, and that was an internal discussion, from our opinion during that time, we had accomplished what we had set ourselves out to accomplish. We went into some negotiations with the University of New Mexico, and we told them, then you need to have community members that are making a decision on the board of these facilities and so on. We're not talking about top-down. We're talking about people from the neighborhood deciding what they want to have and participating in making those decisions.
So there was a group of really dedicated individuals Petrasais, and I can remember Priscilla Gonzalez, Jimmy and Bruce Nieto, and Joe Fernandez, folks like that. Joe Montoya, who was also a police officer, apparently a police officer, formed a core of what we call the CAP agency, the Community Action Program. And they're the ones that were the driving and motivating force for communities coming together. And it actually reached out. It was not just located in the South Valley. I can remember going to visiting all these older communities also, Martinez Town in South Broadway and San Jose, and Los Padillas and Pajarito. We called it the Barrio Tour. We would go and visit with some of the elders and the leaders of those communities and really talk to them about what the issues that they were facing. And they were pretty common. They were universal, you know. Our kids need better education. We need health care. Nutrition is not great. Unemployment was even higher. You know, these communities were neglected.
I actually was involved in community development when they were looking at the needs of the community, and one of the needs, of course, was primary health care for the people in the community. And so I was involved initially in helping write the first grant for First Choice.
Mary Romero got involved with the Model Cities area, and she brought Dr. Sue Brown and Ham Brown to the South Valley, and they wrote up a proposal after they met with the community to get funding to start a new clinic at the South Valley. We the outreach workers, organized and recruited kids from the South Valley to do a study so that we could get the funding. And we recruited 200 kids, and then Dr. Brown wrote a proposal, and that's how we got the funding for the South Valley Clinic.
I can't even remember how I got involved with some of the people in the community, but somewhere along the line I met Mary Romero and started talking to people with the Model Cities program, and this would have been in probably 1969, 1970, and Lyndon Johnson was president at the time. And he was really pushing the Great Society, the anti-poverty programs of those days. And so money was available. And money was available for inner city work, and that's what the Model Cities program was in Albuquerque at the time.
So we got the first grant, and we actually started in a church. We had the first community health center at a church on South Broadway.
And this is where we had our first clinic. That was where the administration offices were housed back in those days. Mm-hmm. This is the first, the first South Valley Clinic. This is where we started out back in 1972. And this clinic was opened in April.
We converted the church. It was a whole church in the South Valley. Not a big church, but it was a whole church, and we built partitions and whatnot, make examining rooms, waiting rooms, the whole works. And at the St. Francis Church, we took over the whole rectory, upstairs and downstairs.
Because of my involvement in the community, I was asked to come and work for First Choice. And I worked as the community the community outreach coordinator. So I was involved in working for First Choice for about 5 or 6 years, doing the outreach part of the community, just making sure that the health service is connected to the community in a good way, and that people were knowing and having the information about healthcare services, and that they had the opportunity to access it. So we did a lot of things like even having a van that would go out and pick them up and bring them to the center. Along with that, we also made sure that there was a lot of health education being provided to the community.
I grew up here in the South Valley, and when I was a kid, it was a different situation. In those days, there just wasn't medical care down here available, even apart from the economics. There just were no doctors down here, and so it's changed now. But I mean, the barriers to service are different now. But you know, I'd grown up, and my family didn't, in any practical matter, have access to medical care or dental care, and it was a subject I was very interested in.
Folks had never seen a physician their whole life. They had never seen a dentist. They never had their blood pressure checked. They didn't know any of that. I could speak to that because I was one of those that I don't think I went to a doctor till I was probably 18 or 19 when I first started college. Before that, I had never been to a doctor.
When we registered a new patient, for example, when you started a medical record, you would have to ask the patient about their medical history. And the sad thing was that some of those patients had never been to a doctor or to a medical provider. And therefore, like I mentioned earlier, that was their first time of having a physical or being diagnosed with some kind of illness or complication. But some of those patients hadn't really ever seen a medical provider. So it was kind of like a lengthy process, being that they didn't have any history. So they would have to do a physical on them, do a lot of lab work, and then ask them about their family history and go from there.
I really felt like nurse practitioners could bring their nursing perspective and treat, and you know, the reality is most of the common diseases are pretty easy to treat. They don't require years of biochemistry and microbiology and stuff to treat things like high blood pressure and diabetes and the common issues of childhood. So it was my, you know, I'm not sure everybody believes that, but it was my belief that they probably would do a better job and would relate better to the clientele than just bringing doctors in. And you know, we tried to hire people that were community oriented and from the community. At least two of our nurse practitioners were Hispanic, Karina and Gerana Griego.
When I think it was in the probably 70s, when I first had my first appointment. I think it was for my daughter. She was probably about 5 or 6 years old. She's now in her 40s. And I took her for an appointment at the first, well, it was, at that time it was called Centro Familiar, and it was in the North Valley on Los Griegos. It used to be at a clinic, the clinic was at an old dance hall that was in the North Valley of Albuquerque. And I was really impressed with the way the nurse practitioner, because the nurse practitioner treated my daughter. It was just, she explained a lot of reasoning behind the treatment. She was very kind. She wasn't in a rush. She just took a lot of time with us. And I know at that time that the nurse practitioners were the ones that were doing a lot of the work at Centro Familiar. It was at that time also that I decided that I would one day want to become a nurse practitioner. I wasn't a nurse then. I was a secretary at that time for the mental health center. And but I was impressed with the kindness of the lady. I wish I knew her name. I would give her credit, but I don't remember her name.
So I just believe that one family member or one friend of another friend probably heard about the clinic, and maybe they were a patient of the clinic and were very satisfied with the patient care, and so they told someone else, and that person told someone else, and that's how we recruited a lot of the patients.
And about 40 years ago, Priscilla called me and she said, Petra and I and Mela want to take you, we want to invite you to Mela's house. It was either Mela's house or Petra's house, to have some chili. And those gals made the best chili in the world, and I live on chili. Okay, I got to have chili every day. So she said, if you'll come over for a chili dinner, we want to talk to you. So I went over to, it was either Petra Sais's house or Mela Naya's house, okay? And I went there and they had a big pot of chili and beans. And they said, kids are having a hard time growing up in the North and South Valley, and they're growing up sick, and we need a clinic, okay? And I said, well, there's several hospitals, you know. There's Lovelace and Presbyterian and St. Joe's. There's plenty of hospitals around. And they said, no, but kids in the valley aren't going to those hospitals, and they're growing up sick. And by the time they catch their illness, it's already too late, you know. So they said, we need a clinic in the valley. And I thought, nah, I said, you don't need a clinic, you know, that's expensive, you know. They said, we need $500,000 to start a clinic in the valley.
So we went around the South Valley asking people what they wanted. And they wanted a health clinic in the South Valley. So in 1974, we went to our congressional delegation, our state legislature, and we told them what we wanted. And we wanted the money to help create a health clinic.
So Manuel said, these ladies are trying to help themselves, let's help them. He said, what I will do is get a team to come in from Health and Human Services, from Washington or wherever, and do a study to see if they really need, I hate to admit this, but I said, I don't think they need a clinic, you know. But he said, I hate to bother you. He said, no, let's look at it. So he sent a team in, and then Jimmy Nieto called me. And he said, this team has been here for a week, okay? And they're doing a study whether we need the clinic or not. He said, in order to show that the community is behind this clinic, we want to have a big matanza this coming Saturday. This was on a Wednesday, okay? He said, we want to have a big matanza and have the whole valley out, you know, 400 or 500 people. And 400 or 500 people was nothing for Mela and Priscilla to put a rally together. I mean, they were great at that. So, and Petra. And so he said, we're going to have a matanza to show support. He says, can you get us 50 cases of beer, okay? So I said, okay. So I called, this was on a Wednesday, I called George Maloof, okay? And George was on his way out to buy a basketball team in Houston, the Houston Rockets. And he said, meet me at the Four Seasons, okay, coffee shop. The Four Seasons is now called Radisson, I think it is, on Carlisle and Manal. He said, meet me there and I'll see what you want. George was a very good community helper. He always contributed to everything. And so I met him there, and he said, I'm in a real hurry because I'm leaving to buy the Rockets, okay? He said, so what do you need? I said, I need 50 cases of beer. He said, go in the lounge, okay, and tell them to give you 50 cases of beer, and I will replace it when I'm back Saturday night. So I did, and they said, if George Maloof said it, you got it.
So our Congressman, our U.S. Senator, Pete Domenici, Congressman Manuel Lohan, our legislature, State Senator Eddie Barboa, Representative Ray Garcia, Benny Aragon, they went to the legislature and they came up with a bill and they created it and they passed it and we got the money to fund it. So in about 74, 75, the money came in and we started building it.
I would say probably 7 years ago, we had a board member by the name of Petra Sais, that when Bob DeFelice got hired, she asked to have a meeting, and Bob and I and Petra sat in a corner of the conference room at our old building, and she told Bob, I want a new clinic for South Valley. And so she gave Bob that task, and from that Bob got, he set up meetings with various different agencies, public health, the county, and the ball started rolling, and so this is what has resulted is this new clinic for the community.
You know, I was educated, brought actually to a meeting after I was elected as senator, and Petra Saiz and her team brought me over to a meeting. Bob DeFelice, of course, was there, and I was educated quite promptly, and appropriately so, to learn more about the needs and concerns of the facility there on Centro Familiar.
When you train at the university, the priorities are often inpatient, it's very subspecialized, it's not the richness of a community. When you see patients at a first choice site, the community is very involved. You're living in the neighborhood, you're working in the neighborhood. Now, First Choice was one of the most important partners with the university because we developed together the concept of a health commons. What that means is we're not just going to have a patient come in and just see a doctor and go home. The kinds of needs, especially in an indigent community, kinds of needs that people have when they bring their medical problems often are social and behavioral. Issues of poverty, housing, access to jobs. And you have to have, if you're going to actually improve health, access to all of the resources necessary for that kind of complex need in a community. So a health commons is like a one-stop shopping. You have dental, you have medical, you have behavioral health, you have public health, you have community outreach, all together in one site. And that's what the First Choice facility is right here in the South Valley. And other First Choice sites, in partnership with the university, are being set up in exactly the same way.
What it gives the community is a steady flow of providers. You know, now that's real important in our situation. You have to remember that First Choice, while we are located in 3 different counties, most of our activities in Bernalillo County. We have to compete with the major healthcare systems for providers. We're competing with Press and the University Hospital and Lovelace, you know, for the same providers. Very difficult, you know, to compete. But if we can get people in through residency and expose them to the kinds of programs we offer, and get them to really understand this type of service delivery and what it really means, and the advantages to them as well. You know, they can have a separate life, you know, besides the practice of medicine in this type of setting. And they enjoy that. It gives us an opportunity to keep a steady flow of providers coming in so we can expand capacity to serve. And we've been very successful. We've been very successful recruiting residents, both medical and dental. Now we also have medical students, nursing students, medical assistants. We rotate a number of different people in levels of training through the centers that we have. Again, exposure to what we're all about, job opportunity. That also relates to, I think, another function that this organization plays and has played for over 40 years, and that's an employment function. You know, the majority of people who work for us, the majority of the 330 people who work for this organization live in the communities we serve. And a good portion of those individuals and families receive care at First Choice. You know, so we really are providing some employment opportunity and some career opportunity for people in the area. And we're excited about that. And the board of directors sees that as one of our missions, you know, is one of our important missions as an organization.
We're providing good job opportunities for people in this community. and provide job training, even if someone gets trained here, even as much as we hate to see them go maybe to some other provider, the fact remains that that person has been trained and has an ability to make a decent living, and that helps the community.
The most recent years have been real interesting. The last 4 or 5 years have been tremendously interesting in terms of growth and development. We've more than doubled our capacity to serve over the past 5 years. We've gone from a small practice to a practice that is comprised of 8 health centers and 1 school-based program. We have over 330 employees, of which 70 are providers of care. We served last year approximately 60,000 individuals and families. We provided them with a medical care home. Those individuals came to care over 250,000 times last year. So we're a big practice. Today we're one of the largest primary care practices in the state of New Mexico. Today we're recognized by the other major providers of care, the Presbyterian and University and Loveless and Molina, as a major player with respect to the delivery of primary care services. The other major change we've seen, besides the expansion of our capacity to serve over the past 5, 6 years, has been our expansion in our scope of practice. And I think this is real important for people to understand. We began as a primary care center. We began by providing primary medical care. We added primary dental care. But as we've worked in the community, as we've listened to the community, and as our board of directors has directed us, we've expanded scope of practice to meet the changing needs of the community. Currently now we've been integrating behavioral health services and have been doing so for the past 4 or 5 years into our practices.
Well, I think there are several levels of it. I think you have to go back to what our mission is, and that's one of the things the board does. Bob and the administrative people can run the business end of it quite well and do it, but we, as a board, we have to keep in mind what the mission, what we're trying to accomplish, and obviously one of the basic things is to provide medical care to anyone without regard to their financial situation, and to do our best to level out any other barriers that might exist, whether they're financial, whether they have to do with language barriers or any other kind of barriers, to make sure that people, not only is this care available, but people feel welcome and included and don't feel any reluctance to get the services that are appropriate.
When I first started working with it, it was like the community had a dream, and now we're in the middle of that, and we have awakened to our dream. It's a wonderful thing.
I feel very proud that we did get involved, and I feel very proud of what First Choice has done, and Primary Health Care Center and all of them, because it was, well, I think that once it got going, there's no doubt that it would do a lot of good for the community, okay? And I think that probably a lot of kids have grown up healthy here because of what happened.
I'd like to say congratulations to the board, those who started way back when, those who kind of midway have grown the facility and grown the organization to where it is, and those who are to come. Because there's a lot of potential, and I believe that what we have here in the South Valley and in other communities, but what I think has started here, there's a lot to be said. Congratulations.
It makes you feel really good, not only for yourself, but for the people in the community who we serve, because that's what we're here for.
I hope, and I think we are known for this now, but I certainly hope that part of our legacy is that we showed people how they could work together and maximize their collective resource to impact the wellness of community. Okay? One person can't do it alone. And it's not just health care that's going to increase the wellness of these communities. It's all the other component parts. It's the jobs, it's the education, it's all these other pieces, the employment that has to be in place. And I think we've shown a leadership, I think we've shown a leadership role to the community that if we work together, if we bring our resource together and use this collective resource to impact communities in need, we can be successful.